Assalamu alaikum. I'm Dr. Jalal. Here I'm having a very important community awareness talk, that is hepatitis B virus infection. So why I am selecting this topic? Because hepatitis B virus, it is one of the neglected disease which can be prevented by 100%, which can be protected 100% if vaccinated on time. And if it is get infected, there is no treatment available for it. So all healthcare workers, nursing, dayas, ward boys, surgeons, dental doctors, all they are at high risk of developing hepatitis B infection, and uh, they are they are not aware about infection, especially class 4 workers. So it is our duty to make them aware and immunize them. So what is hepatitis B? Hepatitis B is a viral borne disease where the virus enters into the body and start damaging the liver. So this is the normal liver. When it get infected with hepatitis B, it will end up in fibrosis and develop cirrhosis of the liver. And if it stays for the longer time, then will end up in the liver cancer that will give very painful death to the patient. So it is one of the vaccine preventable disease which can be prevented by giving vaccination on time and prevent development of liver cancer. So who is at risk of developing this one hepatitis B infection? So nurses are at very high risk because they are exposed to patients and the blood products of patient while giving transfusions, while taking the blood for test, and while administering intravenous and intramuscular injection. The second group of people who are healthcare workers who are at high risk are the doctors, surgeons, and the dental surgeons. And the other neglected high risk group is the ward boys and the MS, because they clean the contaminated surfaces, they play with the sharp needles and all. And the patient group of patient who are at high risk of developing where this disease is the dialysis patient, because they are exposed to the dialysis machine which is used by many other patients are at high risk of developing hepatitis B. And the last group which is at very high risk is the group of patients who are receive blood transfusion frequently, like thalassemia, sickle cell anemias, hemolysis, and other like cancer patients who receive blood transfusion very frequently. So these are the group of people who are in close contact with the other contaminated patients and who need vaccination on time. So what are the symptoms? At acute stage, patient may have dark urine, fatigue, abdominal pain, loss of appetite, nausea, vomiting, joint pains, and the jaundice. So how vaccination, what is the vaccination schedule? So if we give vaccination on time, it will prevent the getting the disease. So in the normal population, we need three doses. One doses at a point, then second dose after 1 month, and the third dose after 6 months. And if in the patient is high risk, it's a candidate at high risk of developing this disease, then better to give booster every year, like for nurses and the doctors and the surgeons and patient who is on dialysis. So I request all of you to get vaccinated before it's too late. Before you uh, get infected, better to get vaccinate, and it is at very low cost. So please get vaccinated if you are not received vaccine before.